peace that you give, even through your Son, Jesus. In his name we pray. Amen.
Everyone please raise your hand. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Just for clarification, hearing persons, hearing statements of persons wishing to address the council.
We have none.
Okay. Moving on to the consent agenda, deliberate and act on the approval of minutes for the regular meeting on September 2nd, 2025. Act on the approval of bills. Deliberate and act on a resolution authorizing the participation in opioid settlement agreements and authorizing the city manager to execute necessary documents. Deliberate and act on a resolution accepting the recommendations of the Planning and Zoning Commission to replat lots 3, 5, and 7, Block 20, Rose Hill Annex, becoming lots 3-R and 7-R, Block 20, Rose Hill Annex, in the city of Hillsborough, being the same property by reference as recorded in volume 1714, page 316 of the official public records of Hill County, Texas, also known as be determined in South Waco Street. And deliberate and act on a resolution to allow waiver of the permit requirement for garage sales for Antique Alley and other citywide events. Council, does anyone have any questions about any of those items on the consent agenda? Hearing none, I'll entertain a motion.
Move to approve.
I'll second.
Got a motion for a second?
Councilmember Fleming.
Aye.
Councilmember Lloyd.
Aye.
Councilmember Robinson.
Aye.
Councilmember Hernandez.
Aye.
Councilmember Richmond.
Aye.
Councilmember Jolly.
Aye.
Moving on to the regular agenda, hear and deliberate on a presentation by Jackson Briggs regarding Waco Family Medicine and its clinic in Hillsborough. Dr. Briggs?
Well, thank you so much for the time that you've allotted me tonight. I'm really grateful to be here with you, and I'm looking forward to this conversation. We began to operate the Waco Medicine Hillsborough Clinic January of 2024, and it's been a joy to be a part of that work. I want tonight to kind of zoom out a little bit and talk about the work from a big picture standpoint. And then we'll get into the weeds and happy to answer questions after I kind of share some big picture. But I'm thinking about what is city council? What is in your purview as you think about the horizon, the future, the thriving of this community, neighbors having access to care that's high quality, the economic implications of primary care. Thinking this is what city really needs to be aware of. And so I'm starting from a pretty big scope. And then as we drill in, please obviously interrupt me. I'm happy to answer questions along the way, but also leave some time at the end to answer questions as well. So I'll introduce myself in just a moment, but first let me introduce my colleagues. So we have two members of Waco Family Medicine Foundation here, two leaders, Vice President of the Foundation, Alfred Solano, Alfred Wade, and then the President of the Foundation, Doug Durham. They're deeply embedded in the region, building relationships, helping folks to understand our mission and our work. So thank you all for being here, joining me tonight. So I'm a family doctor. I came from Houston, where I did medical school in 2003, and I've been in the region since. I love this part of Texas. I'm a Texan, born in Texas. Most of my high school, college was in Abilene. A Wildcat. Abilene Christian was my undergraduate, and then UT Houston for medical school, and then came to Waco to train in residency. Most of my career has been training residents. So I've spent a lot of time in labor delivery, a lot of time in the ICU, and kind of everything in between. But most of my career has been training residents who have graduated from medical school and are becoming family doctors. 6 years ago, I became the CEO of Quico Family Medicine, and so some of tonight's conversation comes also from kind of an academic impulse to think about what it is that we're actually doing when we're providing primary care. So if I get a little nerdy, just give me some grace, please forgive me. I do think that the conversation will feel relevant along the way. So we became a clinic in 1969. The Medical Society in Waco said there aren't enough doctors in our region, and in particular, there aren't enough primary care doctors. We're going to talk more about what primary care is, what primary care does. But at the time, folks were getting their care in ERs, and it wasn't good for the community, it wasn't good for the hospital system. The Medical Society said we need to provide health care to everybody, regardless of insurance, regardless of income, and we need to train the future family doctors for the region. So we became a clinic and a residency training program, the first family medicine residency training program west of the Mississippi. So kind of pioneering in terms of this new specialty of family medicine, which took GPs, the old idea of 1 year of training outside of medical school, and then taking care of individuals in the community, giving them 3 years of much more rigorous training to become primary care physicians. So family doctors are what we've been training since 1970. I'll share some about the Institute and that training effort. But we became a federally qualified health center in 1999, which allowed us to expand. It gave us a financial footing to expand our clinic and to take care of the region's population. And so we'll talk some about what an FQHC is. But our origins are 1970. Our mission statement is to improve the health and wellness of the underserved residents of the heart of Texas by providing effective access to high-quality, comprehensive primary care and an exemplary training environment for tomorrow's family physicians and other healthcare professionals. It's a mouthful. It's a mouthful of a mission statement, so I'm going to kind of break it apart. So first, the heart of Texas. What are we talking about when we're talking about the heart of Texas? So we have Heart of Texas Council of Government, we have Regional Advisory Council, the Behavioral Health Network. We're talking about these counties right here that sort of form a little heart here. So back when we became a federally qualified health center in '99, the vision was to provide health care in this sort of middle third artery of I-35 and to expand that care out into the rural communities east and west of that artery. Now, this group is abundantly aware of this growth triangle. Y'all are living in this every day. You're thinking as council members, the mayor is affected by this rapid growth along the 35 corridor. And our services are really right here, right now, our clinics, I should say, are right here in the Hillsborough to Temple region. We have 14 clinics. The northernmost clinic is the one here in Hillsborough, and we are going to talk way down into Temple. The majority of our clinics are in Gwinnett County. But those who come see us are from this sort of area that's surrounding the clinics, and so a lot of folks coming from rural communities who need access to primary care who are driving into one of those 14 sites to see us. Our growth has been pretty aggressive. This is just to meet the need. We are a private nonprofit. We don't have any shareholders. We're not trying to make any money for anybody who's got an account that's growing. We're just trying to meet the need of the region. So when we have a year that's a year where we're making a margin, it gives us some capital to think about future expansion. When we have a deficit, we're looking at our reserves to make ends meet, but that's the name of the game. It's how much good can we do with the limited resources we have. That growth, that 22% growth, is in part due to our Hillsborough expansion that happened in 24. If you were to look at 25 to date, we've grown by an additional 13%. So we're in a growth season right now, even as we're facing headwinds on funding, both from the state and federal level. In the past year, this is fiscal year, which concludes the end of this month, October to the end of September for us. It's on the federal calendar. We have more than 300,000 visits, and that includes medical care, dental care, behavioral health care. So we provide care in the heart of Texas by doing what? By providing access to high quality primary care. I said I'd come back and kind of talk about primary care. This is the what is that we're delivering. So there's an authoritative body of medicine that sort of gives definitions and guidelines at the highest sort of policy level, National Academies of Sciences and Engineering Medicine. And in 2021, they wrote a report that was an in-depth view, it's a 400-page book really, on the nature of primary care. And in it, they define primary care as the provision of, listen to these words, whole person, integrated, accessible, and equitable health care by interprofessional teams who are accountable for addressing the majority of individuals' health and wellness needs across settings and through sustained relationships with patients, families, and communities. So whole person care that's delivered by a team that addresses the majority of an individual's needs. Not 100% of what ails the human population, but 80-85% of folks' needs across settings, so in a hospital, in the clinic, in the nursing home. And it's anchored in relationships, this trusting relationship. What are the activities, the everyday activities of primary care, improving overall health through regular checkups, early disease management to prevent advanced and debilitating disease, chronic conditions like heat, heart failure, COPD, diabetes, in order to keep folks out of the hospital, care for folks in the ambulatory setting. Costs are lower, people are healthier, and the whole system works better. Increase workforce productivity. So we'll get to a slide that will demonstrate that half the population served at the Hillsborough Clinic are folks between 18 and 65. This is the workforce. This is those who are fueling the economy. And we've got to keep them healthy. We've got to keep them healthy physically. We've got to keep them emotionally, psychologically healthy so they can work and make a living for their family, put food on the table, take care of the community. Reduce healthcare costs. There are models that demonstrate that in $1 spent in primary care saves as much as $13 downstream in healthcare. If I can see in my clinic and lance an abscess and get rid of the pus and maybe put you on an antibiotic, it saves that infection from burrowing, individual getting sepsis, potentially losing their arm, and all the costs incurred by all that. That's a quick visit, it costs virtually nothing to get that done, but think of the scale of the cost savings. And that's just replicated in every kind of situation. Prenatal care, saving those, leading that pregnancy to go to full term, which saves downstream disability and expense and child. Improved maternal and child health. This is the essential from preconception to 4 years old. Is the if there's a 5-year period where we could put all of our resources in order to make the biggest impact in human health, it would be that time period. It's critical in primary care. Mental health and substance use services, obviously, this is a massively growing need. Texas, which I'll get to in a little bit, a little spoiler, Texas is 50th out of 50 states in terms of mental health professional access. So this is a very important need right now. Community engagement and education, emergency preparedness and response. These are all things that are in the purview of primary care. The same group, National Academies of Sciences, Engineering, and Medicine, said that primary care is the only healthcare component where an increased supply is associated with better population health. So, in your purview is the thriving of an entire community. You're interested in access for folks who have rare diseases, but more often you're thinking about the thriving of the entire community. but you can invest in any different aspect of medical services, but none of those, by growing the scale of those services, none of those have an impact on population health, except for primary care. If you want to see population health improve, the investment is in primary care. The authors go on to say, for this reason, primary care is a common good, making the strength and quality of the country's primary care services a public concern. Again, this is why we're having this conversation, because it's a public concern, the quality and access and availability of primary care services. I think about it as critical infrastructure. There's a whole lot of things that we think of as, water and electricity, our roads, healthcare, particularly primary care, is critical infrastructure in any community. And I want to share about the context here in Texas of that critical infrastructure. Here. I'll go off mic. I'm probably getting recorded, I would imagine, but let's see where the problem is.
See, my diagnostic skills are as good at a computer.
Hey. Okay, good. We're back on. So the context of this critical infrastructure in Texas. First, I want to draw attention to the value of rural communities in Texas. And I'm using the definition that's most common right now, 50,000 and below. In a county, we're in Hill County, right up against that. But Texas has the largest rural population in the nation. 4.7 million Texans live in rural communities. 70% of Texas counties are rural, and 21.2 billion in goods GDP are produced in rural communities. So it's an economic engine across the state of Texas. So how rural communities fare in terms of health is vital to the entire state. But it's difficult. I wonder, Doug, would you be willing to advance for me?
I will.
Dr. Schwartz.
Jasmine's got it.
Oh, okay.
I can.
Okay.
Thank you. Jasmine, is that right?
Yes, sir.
Thank you, Jasmine. I appreciate it. You go ahead and advance. Keep going.
Lagging.
Gives everyone opportunity to take a breath. Fill. Consider questions. There we go. One more. Okay. So being a Texan, this is a slide that pains me, because I think there's a lot of things that Texans do better than any other state. Unfortunately, healthcare is not one of them. Texas, first, if we back away and just talk about the economic opportunities in Texas as a state, upward mobility, living wage, Texas is 41st out of the 50 states. So not getting an A or A plus among the states. We're 45th for income disparities, the gap between those who are really wealthy and those who struggle. 49th for women's health. So early access to prenatal care, screening opportunities for women, mammograms, etc. 50th for primary care physicians per 100,000 people. 50th for mental health providers per 100,000 people. Jasmine, if you'll advance the slide. We are 50th in the country for uninsurance. We're the most uninsured state of the 50 states. And why does that matter? Jasmine, next slide. So uninsurance is consistent. There's a tremendous body of literature. This isn't one study. This is multiple studies over multiple decades of analysis. Less preventive care, less maintenance care for chronic diseases, lack of prescription drug access, and higher likelihood of avoidable hospitalization and premature death. But not having insurance has all these implications. So this is a big deal that Texas ranks 50th of the 50 states in terms of insurance. When Texas looked at in terms of its composite performance in healthcare, we are fourth from the bottom. We always say, thank the Lord for Mississippi, because we don't end up at the bottom of some of these scores because of Mississippi. But in terms of cost, access, premature death, prenatal care, composite health performance is near the bottom in Texas. So here's, you're probably saying, wait. I've got friends who come to Texas to go to MD Anderson in order to get great care. Or I've heard of these great surgeons that we have in Texas. All true. We have some of the most extraordinary medicine in the state of Texas. We've got transcath valve replacements. You're going to have open heart surgery to get a new heart valve. Antibody drug conjugates that are transforming rheumatologic disease like rheumatoid arthritis and lupus. Trauma reconstruction. If you're going to be in a motor vehicle accident on an interstate, the United States is the place for that to happen. Texas, and near one of the medical centers, where you're going to get better trauma care than anywhere else in the world. Intraoperative MRI, robot-assisted surgery. It is a gleaming palace of care. But, next slide. But there's the rest of the picture. It's built on a crumbling foundation of population health outcomes. Life expectancy, some of the poorest, in fact, it consistently fares poorer than other developed countries. Maternal and infant mortality, chronic disease outcomes, mental well-being, and health disparities by subpopulation. So you break down the population by demographic characteristics, and you see big gaps between those subpopulations. So American healthcare gleaming in some of its sophistication, and yet if you look at the whole population, it's doing pretty poorly compared with all other developed nations. One of the shining stars, one of the bright lights of healthcare in the United States and in Texas is health centers, community health centers. Federally qualified health centers and community health centers are synonyms. We use those interchangeably. FQHCs. 1 in 11 Americans is seen in an FQHC, 1 in 9 children. 90% of those seen in FQHCs like ours are low income, and they consistently provide higher quality care at lower cost. Fewer specialty visits, same or better quality on key metrics, and 24% lower healthcare spending compared with same payers who aren't receiving care in community health centers. There's a whole lot of reasons for that, and we'll get to some of those details in just a second. Wanted to highlight though our board to kind of, for starters, FQHCs have a patient majority board. That means that those who are receiving the services are my boss. They're establishing the strategic plan, those who are receiving services. So this is our current board, and those that are highlighted in purple are folks who are either from Hillsborough or currently living in Hillsborough, now this is the whole system of Waco Family Medicine, and not just Hillsborough. So keep that in mind. But patients in our system, 10% are 65 or older, 35% are children and adolescents, and 55% are 18 to 64 years old. I think in Hillsborough, I believe it's 51% specifically in that age group. But you see that the bulk of those that we're caring for are in that 18 to 65 year old range. By income for the whole system, 70% fall below federal poverty level. That's $30,000 for a family of 4, $15,000 annual household income for an individual. 24% are between 100 and 200% of federal poverty, so take those numbers and double it. And then only 6% are above. And that's because this is the population we target. We want to care for everybody in the community. We don't do a wallet biopsy. We're not screening folks for whether you have insurance or not in order to see. By payer type, a third, almost a third, just shy of a third of our patients are uninsured. So 18% of the state is uninsured, 30% of our patients are uninsured as a system. The federal grant dollars that we get, which is just shy of 4% of our budget, does not cover that uninsured population. We cobble it together from lots of different sources, but a full 31% of those that we serve are uninsured. 36% of Medicaid, 20% have commercial insurance, 12% Medicare, 1% CHIP. Our revenue is predominantly clinical, but our pharmacy is a key revenue generator for us. We have a special federal designation for our pharmacy, which allows us to purchase medication at the federal government's negotiated best price. And when we build commercial insurance, we build the same rates that any other pharmacy does, and that spread, as long as we're using that margin for caring for uninsured folks or folks who have needs, then we're meeting the criteria of this federal 340B program. So our pharmacy actually generates the margin that helps offset a lot of the costs of uninsured folks that are coming to receive care. And it's a very delicate financial balance, and we're always trying to figure out how do we increase the margins so that we can care for more uninsured folks. The expenses are, as you would expect, the majority of that pie is personnel. This gives you a little bit more deep dive into where that grants and other support are derived from. So there's that 12% or so of our revenues, and here's the breakdown. 33% from federal grants, 49% residency support. This is coming from hospitals who receive federal dollars for residency training, and they provide a stipend for us to operate our residency program. The city of Waco helps offset the cost for uninsured patients in Waco. McLennan County helps offset the cost of uninsured patients in McLennan County at 11 and 7%. So city of Waco, it ends up being around 1 million. McLennan County is about 750,000 to care for a portion of the uninsured that is proportional to those that receive. So I'm going to finish up real quick and then open for questions with our institute, because the institute's a real bright point. I was trained by the institute. This is where I was on faculty for the majority of my career, so it's pretty near and dear to my heart. In fact, of our 6 physicians that are at Hillsborough Clinic, 5 of them graduated from the training program in the residency. So I'll brag a little bit about the residency program, and hopefully you're hearing me also brag about the doctor. So there are 36 residents in a class, as I mentioned, in operating since 1970. We graduated now, this is a little outdated, we graduated a little over 500 residents. And I looked at Clinton County, and it is even, the percentage of it would be even higher, I suspect, in fact it is higher in Hill County, because I think only 2 physicians that practice medicine in all of Hill County have not been trained by Waco Family Medicine. But 81% of the McLennan County family doctors were trained by the program. So that vision the Medical Society has matured now, and we're continuing to supply family doctors to the region. We have 3 fellowships: sports medicine, hospice palliative care medicine, and clinical informatics as well. Our quality, I think this is the penultimate slide here, but our quality, we're consistently evaluated by an independent group that looks at national training programs, and this is like the top 2% of family medicine training programs in the country. Just like, you have standardized test scores like ACT and SAT and MCAT. Well, there's standardized test scores through medical school, and those standardized tests predict how you're going to function outside in residency training and in your career. And our board scores, our residency standardized test scores are on par with those in neurosurgery, dermatology, anesthesiology, and interventional radiology. So what I'm saying is, Now, the docs that come and train with us, they're coming from all over the country. They are the cream of the crop in their medical school classes. And they're aggressively trained. It's a hard program, but they train rigorously for 3 years. And then they graduate and they stay in our region. So we're getting the best talent from all over the country, training them aggressively, and then they're practicing all around us. So we're getting, I think, a really important value in those. There's a slide here, the yellow slide, that will just indicate that there's about 800 applicants, and we take 12 each year from about 800 applicants. So 15,000 applicants, 4,000 interviews, and 500 graduates. I think that's everything. Thank you for your patience. I've kind of went into more detail than you might have expected, but I wanted to kind of set the big picture stage for the work that we're doing. I'd be more than happy to answer questions or talk about the post-work clinic or other needs as it pertains to primary care, mental health, oral health.
Council, any questions for Dr. Briggs? We appreciate your presentation.
Absolutely. I'll review the audience. Thank you. I appreciate it.
Okay, next item on the agenda, hold a public hearing, second reading, and deliberate and act on an ordinance amending the fiscal year 2024-2025 budget.
Mayor and council, you're familiar with the budget amendment. This is the second reading. I'll remind everyone that major changes resulted from having an increase in the police department for repayment of the line of credit proceeds. That was offset by other sources. We had an increase in fire department expense due to capital outlay of plant and ambulances. And on the revenue side, that's increases in ad valorem tax collections and intergovernmental revenues for grants proceeds received.
Council, any questions for the representative? Okay, this is a public hearing, and open it up to anyone in the audience that would like to address agenda item number 11. Hearing none, we'll close the public hearing and entertain a motion.
I move we approve. Second.
Councilmember Fleming. Councilmember Lloyd. Councilmember Robinson. Councilmember Hernandez. Councilmember Richmond. Councilmember Jolly.
Okay, hold the public hearing, item number 12, hold the public hearing second reading, and deliberate and act on an ordinance adopting the budget for the fiscal year 2025, 2026, and act to set a date for vote on the budget.
We're not actually setting a date. We're voting on the budget. Sorry. Again, Mayor and Council, you've heard us say lots of times, this is a pretty flat budget. There is an increase in revenue, there is an increase in expenditures, but there's not really an increase in service delivery. This is to accomplish the same stuff that's our mission all the time. We've had sharp increases in healthcare, as you know. We have some targeted wage increases that we're anticipating to go into effect as of October 1st. This is primarily to address places where similar positions were not being compensated at a similar level, and we needed to make those changes for fairness sake. And in places where we have frontline employees for whom we're competing with other communities, and we're not keeping up, but we're doing our best because we've got we're trying to attract folks, and everybody's hiring people for the same stuff that we are. So those are important components of the budget, and we would entertain any other questions that you have.
Okay,
I
this
do
is,
see that on this slide, outlet mall and tourism are still flipped. I apologize that we failed to make that correction in the last meeting. So that does include the cost for outlet mall demolition.
okay, this is a public hearing. We'll open it up to anyone in the audience that has any questions in regards to agenda item number 12. Okay, close the public hearing and entertain a motion.
Second.
Got a motion and a second.
Councilmember Fleming. Councilmember Lloyd. Councilmember Robinson. Councilmember Hernandez. Councilmember Richmond. Councilmember Jolly.
Okay, next item on the agenda, deliberate and act to ratify the adoption of the budget for fiscal year 2025-2026.
Mayor and council, a separate ratification vote is required to adopt any budget policies to adopt tax rate.
Council, any questions? Entertain a motion. Motion and a second.
Councilmember Fleming. Councilmember Lloyd. Councilmember Robinson. Councilmember Hernandez. Councilmember Richmond. Councilmember Jolly.
Okay, next item on the agenda, hold a public hearing, second reading, deliberate and act on an ordinance adopting the 2025 ad valorem tax rate that exceeds the known new revenue tax rate, but does not exceed the voter approval tax rate.
Mayor and council, again, as discussed, the proposed tax rate is the voter, just shy of the voter approval rate. So this is the increase that we can make without having to have an election. It is higher than last year's rate, but it is lower than the historic rate. You know, forever and ever, it was higher than this. Last year, we actually used the negative revenue rate, and this year, we're restoring it almost to the level that it used to be. And once the public hearing has been concluded, there will have to be 4 votes taken.
Council, any questions? The agenda. Let's open it up to the public hearing. Anyone in the audience that has any questions in regards to agenda item number 14? Okay, hearing no questions, we'll close the public hearing and, let's start, with,
I move to adopt a tax rate of 0.6824 per hundred for general maintenance and operating expenses.
got a motion?
Second.
Motion and a second.
Councilmember Fleming. Councilmember Lloyd. Councilmember Robinson. Councilmember Hernandez. Councilmember Richmond. Councilmember Jolly.
I move to adopt a tax rate of 0.12 per hundred for debt service expenses.
Got a motion?
Second.
Got a motion and a second.
Councilmember Fleming. Councilmember Lloyd. Councilmember Robinson. Councilmember Hernandez. Councilmember Richmond. Councilmember Jolly.
I move to approve an ordinance to adopt the 2025 ad valorem tax rate that exceeds the no new revenue tax rate, NNR, but does not exceed the voter approval tax rate, VAR.
Council, we have a motion.
Second.
Move approved.
We got a motion and a second. Jay?
Councilmember Fleming. Councilmember Lloyd. Councilmember Robinson. Councilmember Hernandez. Councilmember Richmond. Councilmember Jolly.
Mayor and council, rate should be 0.8024 per $100.
I move that the property tax rate be increased by the adoption of a tax rate of 0.8024 per $100, which is effectively an 11.2427% increase in the tax rate.
Okay, we have a motion, can I get a second? Got a motion and a second?
Councilmember Fleming. Councilmember Lloyd. Councilmember Robinson. Councilmember Hernandez. Councilmember Richmond.
Aye.
Councilmember Jolly.
Aye.
Okay, next item on the agenda here, deliberate on the city manager.
All right, it's the second meeting, so we're doing the second half of the goals, these are goals 5 through 8, build better infrastructure is goal 5. Guys, we have asphalt. We have asphalt everywhere. There's like the Ivy intersections, it's all asphalt. So while the project isn't really getting complete, it is like 99% complete, and we are so excited. There are a few places where some concrete work is going to be needed to tie back in. There's places where like around valves and manhole covers and stuff. There are a few places where there's some pavement issues that we're going to have to go in and repair. But for the most part, you know, the big, obnoxious, unpleasant part is done, and we are so grateful. And it's probably time to start thinking about the next one. We continue to be done with the water tower. We continue not to have gotten all the rest of the money from Texas Water Development Board. That continues to be a saga, but we are working with their staff and our group to get that all closed out and finalized. This whole slide is kind of a work in progress since we're not getting any money from Texas Water Development Board. So we did not get the $30 million that we requested from the Economically Distressed Areas Program, even though we thought we were going to, and Mr. said we were going to, we didn't, we timed out. We had put in a backup application for $50 million for the Drinking Water State Revolving Fund. That funding is a lot more competitive, and only really big cities seem to get any this time around. They are going to do some more. You know, I don't know the exact numbers. If you know 8 cities applied and they're only going to fund 8, they may release additional money later on and fund another 5. But we're still not high enough in the rankings. Like we're not going to get money this year. What this means is that we're going to have to do some work locally and just try to hack as much progress as we can. And to that end, we've kind of floated, there are a few things that we need to figure out if we can do. One of them is to replace the block of water line in Waco Street from Franklin to Elm, basically. Actually, from a little bit north of Franklin to Gould, because that is the section that TxDOT is going to be resurfacing. When they resurface it, they're going to go in with 12 inches or 18 inches of concrete. So replacing the water line after they've done that is going to be that much more time-consuming, expensive, and problematic. It's a cast iron water line, it's ancient. It doesn't actually give us a lot of trouble. So, you know, it's on the list to do, but we probably wouldn't do it next, but we probably need to try to do it next. Preliminary opinion of probable cost on that is $615,000. The other 2 top ones on our list, there is the one from the College Tower to the outlet home. That is a larger line that leaks periodically. We lose a lot of water out there. Because that's not in a street and there's nobody connected to it, we expect to be able to get that done much more affordably. We've had some preliminary explorations of price and feel pretty good that we'll be able to get that done in the next few months. We'll go out for bid and formalize all of that. That one we can do. But moving section in Smith Street, there's a section in Sycamore. Each of those are north of $650,000. So no good news. We're just gonna go back and forth with engineers and contractors and see what we can fight to get it down to. Sewer, we've got the wastewater system evaluation is underway right now. There have been smoke testing on the south side, and continuing to smoke test to identify where there are areas where water is getting into our wastewater system. The reason that's important is because if stormwater floods our wastewater system, it's going to create disruptions of service where people have wastewater backups and stuff. That's why. And it also floods our wastewater treatment plant in terms of volume. So plants are rated by how much water they have the capacity to handle. If you've got all the rainwater in the world flowing into your plant, that's a huge problem. So very expensive. So we're looking at that. We've got a first draft of a capital improvements program or a capital improvements plan that would include all of these projects as well as some street repair based on the next code evaluation that you've seen. We'll have that in the next couple of days, and then be working with the Virginia folks to see what, how do we prioritize it and then put all of that together. But it's kind of a grim moment. But what you guys need to know is that we're not going to stand still. Progress may need to be slow, but we have to make progress in our goals. In terms of delivering essential services, we've approved the scope of services and fee proposal for the facilities master plan. This is important. I know it seems like we've got direct stuff that's broken that we need to go fix, but part of what we've got to figure out is where are we spending money that we don't need to, or where do we have things that we can sell and use that money to fund things that we need to do. One of our just realities is that we own a fair amount of property, so some of that property is worth building up so that we can do more with it. Some of it we may be able to get rid of, so we need to do that. Street maintenance, we're out working on. We're trying to found some places where drainage infrastructure is off kilter and portions of the drainage channels are not lined up. So we're trying to make those corrections right now while the weather is good, as well as continuing to work on utility repairs. We've talked a little bit about public safety, where we're going through departmental personnel and policies. Working on rate change recommendations for Waterford. We'll bring those to you next month. We've got the updated leak system. The customers will be hearing a lot more about that in the next couple of months. And as you know, we'll continue working with developers on the additions that are going to be needed to go in with new developments. Repairs continue at Walls Park. And then we've got the next community cleanup. As you know, we're now doing 2 per year. So the fall community cleanup is going to be the last Saturday in September. Boosting economic development, we have Project Dispatch for the Municipal Management District. As you know, that's the system for funding that infrastructure out there. That's been submitted to TCEQ. Project Freeze Pop, we're continuing to move forward. Project Treasure Hunt, we're going over possible investment options. And then Project Pit Stop, this is the thing that we looked at on the south of the town. We're reviewing a development agreement. They've submitted a draft. It's going to need a lot of revision. But we're talking about a possible 50% participation in that infrastructure. They meet or exceed performance goals. So it's going to be all about, what are they generating. Continue to work with Retail Coach on prospects, particularly for the outlet mall. Main Street still moving along in downtown. On that outlet mall, we've got building permits issued and anticipate construction soon on Panda Express, Chili's, and Chick-fil-A, as well as Bath and Body Works. So they've turned over the space to them that they'll be going into, and their construction plans have been approved. Several plans are under review for Waffle House, and then demolitions are still going on. We've had some, it's not a big increase in the grand scheme of things, but no increase is ever good. Some of those piers are a lot deeper than anticipated. So we have give you a phone call, to go over the project. And, we're working on the blow up for the buildings that are gonna stay. Here's kind of the updated, visual, I guess, of kind of the layout of things. So this is kind of what people can expect to see. So phase one, we anticipate the first businesses in phase one to be open as soon as 6 months. And then the last ones, some of those pad sites that there hasn't been a prospect identified for yet, may stretch out as long as a couple of years. Phase two, we expect we'll have building somewhere between 2 and 5 years from now. We don't know exactly yet, because that timeline hasn't really started yet, but what we've been told is that now that phase one is pretty much underway, we should expect phase two to follow fairly quickly. Phase three, not quick. Could be, we're thinking somewhere in the 10-year, probably mark. Library, getting ready to do that door work, continuation of regular programming, Parks and Rec, out at Wallace Park, we've got tournaments every weekend, like through December. We continue to have adventures in plumbing out there, so, that's kind of a challenge, but we're meeting that challenge and, moving forward. We just concluded open enrollment for all the new benefits, so that was great. We did a great job. We've got a number of vacancies we're preparing to get those filled as soon as possible once we start the new fiscal year. Exciting to have the live music at the yard every Saturday night is back up. So we started this past weekend and we'll continue every Saturday night through October. We've got music, movies in the park continuing through October as well. And then our downtown events, Autumn Fest is October 11th. And then Oktoberfest, which is actually a private event, but it will be taking place in downtown, is October 18th.
Council, any questions for
The traffic lights on Church Street, can you give us an update?
We still are awaiting a third bid. We're supposed to have 3 bids, so we're trying to get that third bid.
how long do we have to wait before we just move forward?
If we can document that we have asked businesses and they have declined to give us a bid, that will suffice.
For mowing services?
For the traffic lights.
Oh,
Council, any questions? Okay, no further business, this meeting is adjourned.